So, what is anxiety and how do we deal with it? Find out in this episode of IncreMental Health Tips. Welcome to IncreMental Health Tips. My name is Jared, and as always, I'm joined by my co-host Liz. Today, we're going to be talking about a very common issue. Every human being feels anxiety at some point, but it still is a problem area for a lot of people, and so we thought we'd just have a little discussion on anxiety. What is it? How do we recognize it? And what can we do about it? So, Liz, getting right into it. So, what is anxiety?
So, anxiety is something that's experienced by everyone, and it can range from a feeling of a sense of dread to things like heart palpitations, a pain in the chest, feeling sick to the stomach, feeling nervous. It can include a wide variety of symptoms, and generally it's a feeling of unease, as if something's wrong.
Or if something's like about to happen, like a word that really, when I started my undergrad and took intro to psychology, what the word that really resonated with me was dread. Feeling just like impending doom. So that's what anxiety is, but one just observation and what I find from what I've studied, and I'm sure what you've experienced too, is anxiety isn't always, while we all have it and we all know we have it, it's not something that's always easy to recognize within ourselves. So just an example, when I was in high school, I would end up feeling around a really particular time of day too. I would feel just really ill, and I just, didn't look good, and so I would have to get out of the class, and I would have to, sometimes go home, and sometimes just go to the nurse's office, and I would just feel really ill, and there was just no real explanation for it, and I ended up assuming, well, I'm having some sort of medical problem. And so I go to a doctor, I go to a specialist, I go all the way down the line, and the specialist ended up saying, well, this to me sounds like a psychological issue. This sounds like something you should actually talk to a therapist about. And it turns out that what I was feeling was actually anxiety around a particular class that I was taking. It was a really tough class, but it never made me think that, well, maybe my nervousness around a class or my anxiety around a class could actually manifest into physical symptoms. And so it took me years after that experience to actually realize that I was feeling anxiety at that time. And so anxiety can go unnoticed. So based on that, Liz, understanding what anxiety is and that we all experience it, but sometimes it's hard to identify. How do we identify anxiety within ourselves?
So I think if you're, for example, starting a new job, it's normal to feel a little bit anxious about that. What are people going to think of me? Am I going to be able to do it? Am I going to like working there? So there can be a lot of questions running through your mind that can cause a little bit of anxiety as you start a new job. And those sorts of things can happen on a day-to-day basis where something comes up that feels uncertain and you can get anxiety around that. So the difference between having that regular, normal, kind of healthy anxiety that helps you get a little more focused and prepared is that an anxiety disorder can be debilitating. It can cause people to completely avoid things. So if you think of an agoraphobic, they may not even want to leave the house because their anxiety is so strong.
Well, yeah, and the whole debilitating thing is really the key part of it. If there's an aspect of your life or an area of your life that you just cannot function in, you've got to try to find, you may not know that it's anxiety, but you've got to try to find the root cause of it, which could be anxiety, or it could actually be some other underlying issue, whether psychological or physiological. So it's important to consider the possibilities, because you also at the same time don't want to dismiss a serious problem as, oh, it's just anxiety. Like an example is a really common thing is when when people experience severe chest pain, the most common association with that is heart attack. And severe chest pain is something that you should take very seriously. And so by all means you should go to the hospital and get checked out. But one thing that's actually really common is for people to go to the hospital to get checked out for severe chest pain, and the doctors find that no, it's not a heart attack. It actually could be just anxiety. And so, but on one hand, obviously serious issue, so you want to go get it checked out. But on the other hand, you don't want to, when you're feeling like you're having a heart attack, you don't want to say, oh, that's just anxiety, because that obviously could have really bad consequences.
So one thing therapists may recommend if you're doing therapy and you have that feeling that you're having a heart attack is that you can do something like jumping jacks, which you wouldn't be able to do if you were having a heart attack. And then that will help you to realize, well, I'm not having a heart attack. And it could actually help with relieving some of that intense anxiety.
Well, I think, yeah, anything you can do to reduce the overall, to feed the whole cycle of panicking and worrying and then panicking and, like, one of the worst things you can do if you think something is wrong is go to a search engine and type in Google, whatever symptoms you're experiencing, because Google is going to communicate all of the possibilities, even the less likely ones, like it could be some really rare form of disease, or it could just be something really minor. But of course, you're not going to be in a rational state, so you're going to end up thinking you're going to think the worst. It's not going to help you calm down at all. So being able to challenge some of your thinking can help reduce that cycle. So you mentioned that as one recommendation for how anxiety is treated. Do you have any other just practical tips for how we can deal with the anxiety that we experience on a daily basis?
Well, there can be a wide range of anxieties, like social anxiety. OCD is a severe form of anxiety, general anxiety disorder. There's phobias, there's panic disorder, which is when someone has panic attacks, but there doesn't seem to be any real cause for the panic attacks. And so there can be a huge range of different types of anxiety that may need different kinds of treatment. And so if you find that you're having anxiety and you haven't been able to make progress with it, the first thing to do would be to get a diagnosis, so that way you can get a better sense of what would help you improve your ability to manage your anxiety.
Or even if it's not, to a level of a diagnosis or a serious disorder, you can actually get strategies on how to deal with the specific problem by seeking out help with it. But anxiety is a big topic, and maybe we can go a little bit deeper into all the various other types of anxiety. You mentioned social anxiety. That's a big one for a lot of people. I think especially now, as everything starts opening up after the pandemic we've faced for the past couple of years, we end up with a lot of tensions and a lot of fears about the uncertainties around us. And should I go do this thing I used to do? And so it's always good, if you're unsure, to check it out and talk to someone and get it diagnosed if you can.
Yeah, and one of the common treatments for anxiety can include cognitive behavioral therapy, which can really help quite a bit with anxiety because it teaches someone to look at the different ways that their thoughts are distorted. So something like catastrophic thinking, where you just think of the worst case scenario of things, that recognizing those thought patterns and learning how to challenge them can make a big impact on how you're able to manage your anxiety.
Well, and anxiety as well can be an emotional response to distorted thinking. And so, if you're interested in more on these topics, we've discussed cognitive distortions at length. We've discussed these topics some, but we've still only scratched the surface. So, maybe this is another area that we'll revisit. But that's all the time we have for today. But if you enjoy this content, please like, share, and subscribe, and also comment. We're really trying to grow and spread some general mental health awareness, and especially now, the world just really needs it. So until next time, remember that small steps can lead to big changes, and we'll see you next time.